We have executive advocate and family member Lynda Cutrell has served as former president of the board of directors of the National Alliance on Mental Illness, or NAMI, Massachusetts. Her focus was building public awareness, outreach, education, and advocacy. She initiated the Crisis Intervention Project in Massachusetts to build alliances within the law enforcement arena and first responders. She served 2 years as a member of the Governor's Mental Health Advisory Council. Most recently, and what she's here to talk today about, she created the 99 Faces Project, which was exhibited at the Boston Museum of Science. The project addresses the science of our mental health and promotes the narrative of actual recoveries. The exhibit continues to travel throughout New England. Lynda also served on the NAMI National Board in Washington as chair of Transitional Age Youth Policy, Anti-Stigma Campaigns, and Family Education Initiatives. She was formerly adjunct professor at Boston College's Majors program, lecturing on marketing and communication plans that build national awareness in both mental health and nonprofit arenas. Prior to these roles, Lynda was a senior executive in financial services in Boston and New York for 25 years, working in domestic and international markets. Lynda speaks regularly on the importance of family support in the area of mental health. So thank you so much for being here today, Lynda. Okay, and then next we have Suzanne Weete. She is the Community Education and Engagement Manager with Community Partners. For the past 3 years, she has worked to bring mental health education and awareness to our community. She is a founding member of the Dover Mental Health Alliance, an alliance of a cross-section of community stakeholders dedicated to the vision of a culture that understands, embraces, and addresses the complexities of mental health. Her work includes engaging civic and business leaders, first responders, community, school, and faith leadership, and business owners to become more informed about the importance of mental health among their employees, clients, and colleagues, and to normalize the conversation about mental health challenges by digging deeper into their own perceptions for themselves and their employees. Suzanne has worked in the nonprofit sector in Strafford County for the past 20 years, dedicating herself to the health and wellness of the community. So thank you so much for being here, Suzanne. And then last but not least, we have Janet Salsbury. So Janet is a licensed clinical social worker and is the Chief Clinical Officer at Community Partners, the Mental Health Center in Strafford County. She has worked at the Mental Health Center for 26 years and has 30 years experience working with children, adults, and their families regarding mental health and treating their mental illness. Awareness and stigma related to mental illness is a priority issue for Janet. So thank you guys so much for being here. And without further ado, I'm going to stop talking so they can start talking about such wonderful, important stuff, especially since May is National Health Awareness Month. So Lynda, if you want to
Sure.
oops, by talking.
Thank you. I'm going to have to cut my bio down. That took way too long, I thought. I'm going to show you a video of the exhibit, but so I put together this mental health awareness exhibit, and it was at the Boston Museum of Science. And the whole reason I did it is because I felt as though we needed something different to break through with stigma issues. And I felt like there had been lots of writing and lots of meetings. We're having a meeting here now, but I felt like, how do I reach the broader audience? How do I reach beyond the choir? And I put this exhibit together with more of a science sort of perspective to it. And the Museum of Science was willing to work with me because I put the science behind all of our mental health. And I didn't just address sort of I started doing this maybe 10 years ago. So there was more of a pity kind of approach that we all should care about others' mental health. And I felt like we needed something newer and fresher and just more of a scientific understanding. So in order to do that, I went to, we have here in New England, right in our backyard, we have an enormous amount of neuroscientific research and development going on. And so I went to McLean Hospital and I worked with the head of the neuroscience lab to find out what was going on and to help with my own understanding. I had a family member who had the onset of schizophrenia and felt like I was, reasonably educated person, and I didn't know anything about it. And I felt blindsided by what is this illness that actually affects one person in 100. If we think about COVID right now, people who get COVID, 1 in 100 die. So we're much more in tune with things that we think can happen to us, but 1 in 100 people develop schizophrenia, and it's the leading cause of lifetime disability in the 18 to 24-year-old age group. And look at the difference on what we know. Clearly, one is more broadly, affecting all the people on the planet. But 1 in 100 means that 1 in 50 parents is dealing with this. And it means that a lot of people are disabled unless they get treatment for their lifetime. And so appealing to a bipartisan nature, there's the empathy and care and love that you have for individuals, but there's also, we're supporting 1 in 100 people for their lifetime because we don't have adequate recognition, diagnosis, and treatments. And some of the illnesses, you can make some progress in an individual's recovery, but usually there's always something that makes their lives better. And people want to return to productive lives. Everyone I've met, and I've met actually hundreds of people with both bipolar illness and schizophrenia. So what I did was I approached the science, and I also approached looking at individuals with these illnesses and finding champions within those groups, just like we have champions of, cancer and, sort of like survival from war. Where were the champions for mental illness? And there are some. So I did this exhibit on all these different fronts. So let me show you the exhibit so you can kind of get a sense of what it looks like. All right, so screen share, right? Beginning of this exhibit was probably 10 years ago when some individuals that I know and care deeply about had the onset of some severe mental illnesses. I didn't know anything about it. And in trying to support those individuals, I started to seek out, what happens to an individual that might have schizophrenia or bipolar illness. The onset is late teenage, early adult years. And what I found was there are no really positive stories, no information about how prevalent these illnesses are. And what I wanted to do was create a body of work that would give hope and sort of more understanding about what these illnesses are. The implications are that we all have these symptoms, but it's all about different degrees. So the 4 major symptoms are depression and anxiety, and I think we can all identify with that, mania and psychosis, the more difficult ones. But we do all experience those in different amounts. What I was looking to do was find people who had the more chronic symptoms and how they recovered, and give hope through portraits of individuals and the people who supported them through their life, and so that they had recovery. On the wall, you'll see 99 portraits, 33 with schizophrenia, 33 with bipolar, and 33 people who love them. It's a very broad and diverse collection. And the selection of individuals that are in the 99 Faces project follows the 2010 cultural ethnic diversity that was recorded, so that when anyone walks into this gallery to see this exhibit, they can identify with someone that looks like them. So it's to try and not say these are other people and should be pushed aside. These are all of us. So we're all in this. I've made, through the use of paintings, the research more accessible to anybody who walks in. So I think you can look at my paintings, get the essence of what the research is about in probably 60 seconds. So those are actually skin cells that show a difference in the mitochondria of individuals who suffer from these illnesses, and it's different. So the message in that is that this is not just in someone's head, it's a systemic illness, and we yet don't have any methods of treating schizophrenia in its full systemic onset to someone's body. Same with bipolar illness. Then there's a sculpture of the DNA strand. So that's 23 pairs of chromosomes. And that can appeal to anybody, even if you're not looking to learn about mental illness. But the DNA strand is the instructions to create you as you are. The whole reason we're all different, why your face is different from mine, your height is different from mine, our eye color is different, our fingerprint is different, is that the instructions have 25,000 genes, and they're all different between all of us. That's why there isn't a single person on the planet that's the same. And my message in that, if it drills down into the mental illness situation, is no one's brain is the same. So we're trying to fit and compartmentalize people into other groups when the understanding should be that we all think differently. I'm trying to talk about the uniqueness of an individual with or without a diagnosis. I think I'm very curious, and I'm always looking to take the value of science and put it into my art. Like behind me is painting that I did when I was curious about what the population of the United States looked like. So this painting is 850 squares, and I matched them to the skin color on 850 people according to the US Census data. And this is the color of our skin. And then behind some of these are the disease that lives underneath the skin, which would be a mental illness. So there's PTSD and schizophrenia, depression. I wondered how many people in a room, would be experiencing symptoms to the point that they were diagnosed, with an illness. So there's two sculptures in the exhibit. One is the DNA sculpture, which, here goes the science thing. It's like, I'm a little obsessive when it comes to science. So I made that DNA strand so you could see it, 1/16 of an inch thick. And it required 4 miles of fiber. And every single chromosome is done to scale, all 23 pairs. So the largest one is 85 inches long, because in our body, it's 85 micrometers long. And then the smallest one is 17 inches. And so it took me 6 months with a workforce of 25 individuals. And we all learned where the genes were and where the proteins are and the histones and amino acids and all of the stuff that is in that. So that was to sort of convey how complex we are as individuals. The second sculpture I made is to also address sort of the fact that we all suffer with symptoms. So the base of the sculpture is from a chart from the 1600s, which is the 4 humors. And the 4 humors were how doctors used to try to diagnose people. Use that chart because it was the old way of looking at things, even though it's not correct. It tells us that through history, we have always been interested in a person's emotional state and what makes them who they are. On top of the sculpture is a new way that we look at things, and every single piece of the sculpture has an organic form to it. So there's nothing with a straight edge. The bottom is completely straight edges, circles, and triangles, which is what was used. The top of the sculpture is organically cut, and I used 4 colors to indicate each of the symptoms. And I used the volume of color to the volume of the surface of the material to be the same as is indicated by NIMH, the National Institute of Mental Health. So the prevalence is based on color, but not one single part of the color is static. So it looks like it's flowing. And the implication is that we all have these things, but they're fluid states. Mental illnesses are fluid states. Somebody who even has the worst amount of psychosis is not always psychotic. So there are moments of clarity. So in the sculpture, there's parts of the sculpture that are completely clear, and then the light filters down onto the previous base so that it almost looks like it's watery and fluid. The hardest part actually was the beginning of the discussion in putting it here at the Museum of Science. We felt like it needed to move out of sort of this like desire for empathy, and people are fatigued with causes. So we didn't want to approach it like a cause, even though underlying the agenda is to sort of break down stigma. But to put it in the science context, I also know that the way that stigma is broken down is usually when a person meets an individual, whether that be a racial situation or something you've been afraid of before. When you come face to face and you meet someone, that usually helps break down a barrier. The message underlying is, we hesitate about mental illness because it's been stigmatized, but the reality is we should be getting a mental health checkup as easily as we get a physical checkup, because it's going to happen to you sometime in your life. I don't know anybody who hasn't suffered from anxiety or depression. Do you? Okay. Am I back?
Yes,
Okay.
you're back. Yeah.
Okay. All right. So what I was trying to do was bring more people to the table, whether they came because they wanted to see art, or they came because they were interested in science, or they wanted to see what the DNA strand looked like, and then to sort of like stealthily talk a little bit about how all individuals are unique. We know that. And so is our mental health. We have a physical and emotional health, and it's all different. My physical health is different from yours, and my emotional health is too. So it's sort of like to bring that discussion up, and to sort of break down the stigma. So the interest is really high in the communities now, but I think that the information or the detail of what mental health really is low. So I was hoping to provide something to build on, as opposed to talking about an individual, talking about all of us and how no one has the exact same mental health. No one has the exact same physical health. I think we accept that one, but we're still battling in understanding that emotionally we are all different. And also to talk about the commonness. Schizophrenia, surprisingly, is 1 in 100 people. Bipolar is 3 in 100. Depression is 7 in 100. Although I think all of us right now during this period of COVID, I would say it would be more normal to be anxious and have anxiety and depression. I would kind of think that if you didn't, that might be the more abnormal stage. So, but I'm talking about truly chronic depression. So the one that is just profoundly sad. And that affects a lot of people. So I used art because I felt like I could deliver a big message without having to lure people into maybe the same old conversation. But what I did find in meeting all the individuals that I put in the exhibit, so there's 99 people. It's 33 people with schizophrenia, 33 people with bipolar illness, and 33 people who love them. And they're all mixed up and you can't tell who's who. But what I found was, and I was doing this also for my own sort of research for my family member, is what caused most of those people to have recovery. A lot of those people are working. Some of them are authors. There's an actress in there. There's a Pulitzer Prize nominee. There's like 5 doctors. There are 2 Supreme Court justices. state Supreme Court justices in the exhibit. And if you want to see it right now, it's up in Concord, New Hampshire. It's at, I installed it the last 2 days at their big YMCA, which is a block away from the Senate building. And the goal of having it there is that there's a number of people, New Futures and Riverbend and some others, who work hard to advocate for mental health treatments and even hospital beds. They wanted the exhibit there, and I was like hesitant to put it in the Y, but it's across 3 floors and it looks really great in this 100-year-old building. But they want to get the legislators there for an event to walk through and see what can happen with recovery. So all of those folks that have these, recovered lives, some is just an improvement and have a nice, they fit nicely in with their family and a loving situation. They all had 4 things in common. They had some sort of personal self-soothing practice, sort of like their meditation, or they painted, or they read, or they listened to podcasts when they're feeling anxious. So a self-soothing practice that's their own, that fits for them. And they had some sort of treatment. So, therapy and in many cases, medication, because, it's caused by, this imbalance that does happen between the 4 major, the dopamine and the glutamate and the serotonin, and now they're thinking choline as well. But a fraction of a change in what your body produces in those can affect a change in behavior. So that's the case where medication may be necessary. And the other thing is they have a purpose in life, and always had a loving, supportive individual in their corner. And that seemed to be consistent with everyone. I didn't see anybody that didn't have somebody that they really acknowledged a loving relationship with a family member or a friend. And that's the importance, as we educate the public, that people aren't going to recover if they don't have, love in their life. But that's true for any illness, I think. It's the same thing with cancer or something else. You have to have, a desire in your life, a purpose in your life, people that love you. It doesn't have to be a lot of people, but that person that is always going to be there. So it was very informative for me to actually make this work and to try in so many ways to get a little stimulation in folks' minds about, the science or sort of like what recovery looks like. So I think we've done a really good job over the past few years, not just me, like all these folks like Janet and Suzanne and hundreds, thousands of others that work in this field to make people happier in their lives. So now we're identifying, and stigma is breaking down, and people are seeking treatment earlier. 10 years ago, it would take 8 years of someone being sick before they would get a diagnosis. And I think the population numbers were something like 45% of all people with extreme mental illness were getting treatment. Now it's like 65%. So we still have a ways to go. So we're identifying more, we're screening earlier, people are getting treatment earlier. But what hasn't kept up is the number of beds and number of services that are needed once we've identified everybody. It's not like there's more people that were sick. It's just like we've identified the need to help. So those people were, the same percentages were sick. And now we've like identified, and they're willing to get treatment, and we're pretty far behind. I have a very loved family member who ended up in an ER for 8 days. And this is up in New Hampshire. And he was told the wait list for a bed he was 50th on the wait list. So that was pretty hard to hear. So that's sitting in an ER pretty sick, and they don't have all the medications in the ER to help someone. So there's a lot of effort being launched right now to try to have more beds to accommodate more people that actually do need treatment. It's not like we don't need them. We do need them. So anyway, so I invite you now, May through August, to see the exhibit up at the Concord YMCA, which I think is open 6 days at the moment. So, are there any questions?
So thank you so much for sharing, Lynda. I do have a comment from Steph, who said that they loved the focus of what caused them to recover instead of what caused them to develop a mental illness. Both are valid and important questions, but I so rarely hear conversations about how people with severe mental illness live full and happy lives. So was there a reason why you decided to go towards that shift instead?
Yeah, as humans, and comes from my marketing background, we get excited about learning something new in a positive way that can truly be helpful. Like many of us do donations to causes and things like that, when you think that the cause is going to, use the money well or use the resources well. It's sort of like, if we want people to get better, we need to know what it is that's going to make them better so that we can do those things. And it's a better message. People can recover and become employed. Even, it's very interesting at the Concord Y. It took me almost a day of installing to realize that all the workforce that I was working with were supported recovery individuals. So those are people with extreme mental illnesses that are in treatment that have a supported employment job where they get some accommodations. But, these were people that were helping me wrap and unwrap and climb ladders and do all kinds of things to get the exhibit up. But it took me a bit to realize what the Y was actually doing. They were giving people jobs. And those people were so proud. Not everybody gets to be a doctor, but there are those stories out there, and I don't think they're well known. So we need to look at that. I think people get excited about sort of donating to cancer research and things like that when you see champions. But when you see photographs of people with extreme depression or mental illness like we get from the media, it just, you want it to go away. So.
Great, thank you so much. Does anyone else have any questions at this point for Lynda? Give it a few seconds. If not, then Suzanne, would you mind taking the reins here?
Sure, thank you. I just want to say first, Lynda, I always appreciate and love hearing you speak. I've heard you speak several times and have seen the exhibit. It's just fantastic. I love there's 99 faces. They're like lifelike size, if it's a headshot kind of situation. And it's just that, as you said, it points out that these are just you and me people. These aren't people that are portrayed in the media as people that would be institutionalized 30 years ago or whatever. These are you and I. These are our neighbors. These are our friends. These are our family members. And so it begs the question for me is why is living with a mental health challenge or a mental illness so taboo still? And I do agree. I do think that the stigma is breaking down, starting to, but geez, it's been around for a long time. You'd figure we'd be a little bit more ahead than we are. But I guess one thing regarding this past year and the pandemic, and it's just been a devastating year for so many, with so many people lost. But if there's a little tiny silver lining, is that it's really helped to shine a light on mental health. And I feel that people are talking about it because of the isolation that people had to live through, and lack of touching anybody with hugs or anything like that. Right. So, I'm a pretty positive person. This year's been hard for everybody, but the silver lining, a little tiny silver lining, is that we're thankful in some ways that it is shining this light on mental health, and that it's just as important as our physical health, and we shouldn't be ignoring it. Or, you know, health doesn't stop at the neck. So, but so thank you. And I also want to say, Amy, thank you so much for having us on tonight to speak about this important topic, kind of as a global scale, which sort of Lynda really talked about, showing those 99 portraits. Even it's really a representation of kind of the country, as she said, as with those with mental health challenges. And we're going to also bring it down to more of a local level here. And I'm going to talk a little bit about some of the initiatives. And I definitely want to bring Janet in, because she's got the clinical background to talk about, you know, signs and symptoms and things like that. So at some point, I'd really like to turn it over to her so that we can, you know, have some real practical knowledge as every day as we're living through our lives and interacting with people. But so thank you again. But what I'd like to do is just talk to you a little bit about what we're doing here in Dover. Now, I'm part of Community Partners, which is the local nonprofit community mental health center in Strafford County. We are one of 10 community mental health centers in the state of New Hampshire. We're all sort of regionalized in different areas. The closest one to us is also the Seacoast Mental Health Center, which is in Portsmouth. But there's, you know, others in the western part of the state, in the northern part of the state, the central part of the state, but we are all part of the system of the community mental health centers. Community Partners also works with those with developmental disabilities, and we also offer family support services. So we have lots of different things going on with the developmental disability side of the house as well as behavioral health side of the house. And we are one of 2 centers in the state that do that. So there's 10 community mental health centers, and 2 do exactly similar to what we do regarding the developmental services and the behavioral health side. So working with Community Partners, I've worked in this community, as you mentioned, for a long time, 20 years almost, in nonprofit work here. And Dover is a fantastic community. My kids have all currently in school and have graduated and not going too far from home to UNH. And I just know the heart and soul of this community is strong. And, you know, we've gone through some hard times in this community with some people that have passed away and have taken their own lives, and as well as just, you know, endured lots of different things, the pandemic aside. But it's a resilient community, and some of the things we're doing here locally is we're trying to even build some more resilience when it comes to mental health, education, and awareness. So that brings me, I'm just going to show you a few slides if you all don't mind. I'm going to talk about what we call the Dover Mental Health Alliance. Of course, I have to find it on this thing right here. And I will share. And can you all see that? And I'll start from the beginning here. Okay, so again, just to bring this down a little bit locally to see and kind of share with people what's going on here locally. It's been 2 years just about now. We held, the superintendent of Dover Schools and myself and some others held a summit called Mental Illness and Suicide Prevention in Our Community. It was held in Wentworth Douglas. There were stakeholders, high-level stakeholders from across the community in all sorts of sectors, business sectors, religious sectors, the school district, first responders, civic leaders who were present. And we held a summit to talk about mental health and mental illness in our community and what people are seeing or sharing or what they didn't know or what they did know. And what basically was derived from the summit is that this community, and it's probably pretty representative of many communities across the country, this community wants and needs more mental health education, practical information for lay people. Like, I'm not a psychologist, I'm not a therapist or anything like that, but mental health education and awareness and tools where we can help someone in distress. And whether it's just understanding what it's about, or if we wanted to take the step and actually be able to help, understand how to help somebody. So the key takeaways in the summit where we really want to work on this, eliminating the stigma. Lynda talked a lot about that. We want to increase mental health education and awareness, and we want folks are interested in the ability and the willingness to respond to people with compassion. Some people just don't know how to do that, especially if it's someone that you saw that was maybe in emotional distress and they were a stranger. And also what came about of this summit is that the Community Mental Health Center is not the only entity in town that can solve this problem, nor can the hospital, and nor can the school district. The school has so much that's put on their shoulders to raise children, but they can't tackle this problem regarding mental health, stigma and lack of education on their own. So it really, what resonated from the summit was that this is a community challenge, and that we need all participants. We need you and I, we need the local store owner, we need the civic leaders, medical professionals, school professionals. We all need to come together and figure out ways to address this challenge of mental health education, stigma elimination, as well as suicide prevention. So from that, the Dover Mental Health Alliance was born. Lots of people came, raised their hands and said, I want to be a part of this. So we've been meeting now for 2 years, and through the collective effort of the Alliance, this Dover Mental Health Alliance was created with our logo and our vision, which is a culture that understands and embraces and addresses the complexities of mental health, with a mission to build a resilient community that is educated, responsive, and conscious of the impact of mental illness. And that was really born from wordsmithing and talking and having really some great conversations with community members about what we want our Dover mental health, what we want our community to look and feel like. And so this was derived from the meetings. And we currently we have meetings monthly still, and anyone's welcome to join. You can find information on the Dover Mental Health Alliance Facebook page which is at Dover MHA, and we have events listed there for this particular month anyways, because it's Mental Health Awareness Month, but also our monthly meetings. So we invite anybody to join. So how are we going to reach our vision and our mission? So we have lots of different strategies that the Alliance have come up to get, have built in the form of a logic model. What we want to do is we want to create what we call places in our community, and these are DMHA, or Dover Mental Health Alliance designated places. And these places, after going through meeting certain criteria, they are defined as safe, judgment-free places in the community. The library, Dover Public Library, was actually the very first place that was designated back in, when was that, Amy? Maybe March or late February. And what the majority, if not all of the librarians did, is they had agreed to say, we want to make this a judgment-free space for our patrons and for our employees. We have the general public that comes in the door, and sometimes we run into situations we don't know quite how to handle something. So they wanted to become more educated. What they did was they took this class called Mental Health First Aid. And what that is a first aid-like training, kind of like you think of CPR or general first aid classes. But it's like a first aid-like training that teaches or gives people the tools to be able to recognize and respond to someone in emotional distress. So it really gives you the words, the actions. Sometimes maybe just someone needs to be, taught. Active listening is a great way to actually help someone if they're starting to emote what's going on with them. But also not only those tools, but when I took this class, I really found that people do need to understand that compassion piece. Everyone has something going on in their life. And we all, like Lynda was saying, we all have mental health. It really depends where we are in the continuum. We have ups and downs. That's a part of life. It's whether or not we can handle those ups and downs, where we can get into, we might need more support. So this mental health first training is available for community members. There's a few different modules for adults to either recognize and respond to adults in emotional distress, or recognize and respond to youth in emotional distress. So we are offering through a grant, offering this class free at this particular point through a grant that was received from the Connections for Health organization that has been part of this region for the last 5 years. We also talk about what we call adverse childhood experiences, and if it's something, if that's something you've never heard of, check it out online. ACE, it's short for ACE training. And this talks about how chronic childhood trauma, how it affects and shapes, young adults, later in their life. And I'm not going to get into all that. That's something that Janet would be a perfect person to chat about, and she can do that a little bit later. But this is fascinating study that correlates really to why potentially someone may develop a substance misuse disorder or potentially mental health challenges. So we are offering that training free of charge as well. We are also, with all this, we're going to be offering opportunities to help organizations develop mental health best practices and policies. We want to help guide people so that guide organizations, whether you're a faith organization, a nonprofit, a local mom and pop shop, the library, the hospital, we are here to offer some resources to help you create that mental health friendly organization for your employees and or for your patrons. So again, this is an innovative approach to mental health and wellness, and this is a community effort. We have to do this all together. We must open our hearts so that we can show that compassion and share that compassion and normalize the conversation about mental health so that people feel empowered to get the help they need without shame or discrimination. So again, these places are recognized as safe, judgment-free spaces for employees or customers. Again, mental health first aid and ACEs training will be provided to organizations that would like to become designated as a place. You'll uphold the mission and vision of the Dover Mental Health Alliance. You'll have resources available, of which I can show at the end of this presentation. And also, there'll always be someone, like at the library, there's always someone there that when they're open for business, they're trained in mental health first aid and could offer support if needed to an employee or even a patron. So what we're really trying to do here is we are trying to create mental health friendly workplaces or organizations and to create mental health friendly community here in Dover. And so how I'd like to say this is that we are planting the seeds for culture change one place at a time. And together we can build a resilient community that understands, embraces, and addresses the complexities of mental health. This is going to take time. This is not a one and done year, 2 year, 3 year project. This is going to take time because people have their own perceptions and messages in their head about what mental illness is. People don't realize really that we all have mental health, and we have all, like Lynda said, we all have periods of time, and we all have the same sort of symptoms and things like that, just different degrees, but we all do. Mental health is part of your overall health. So we know this work will take time, but we're feeling that people, the feedback we're getting is that people are really interested in this, and now more than ever because of the pandemic, they want to be able to support themselves, their neighbors, their family members, their employees, their patrons, and to, again, create this mental health friendly community. So that's a little bit about the Dover Mental Health Alliance. I can now stop sharing. But anyways, I don't know if anybody has any questions regarding that, but that's one of the things we're doing here locally, in addition to the Community Mental Health Center's ongoing short and long-term therapy and counseling that they offer. But we're doing this more on a layperson's community kind of grassroots level, this Mental Health Alliance. So if anybody has any questions, I'm happy to answer. Or I'd also like to have maybe Janet, if you wouldn't mind, talk a little bit about ACEs, because that is a fascinating study, and also maybe a little bit about some of those signs and symptoms maybe that we might see that we don't know quite what to do with, that we might be observing someone in emotional distress. So I'll leave it.
No, I'm happy to jump in and talk a little bit about all of those things, but I just wanted to start by saying thank you to the library for hosting this, because again, it is such an important topic to just keep talking about. And Lynda, I really do appreciate your frame on looking at severe mental illness. You've given a voice, and a very specific voice, to people in recovery from not just mental illness, but severe mental illness. And in my world, there are even degrees of mental illness, and even I know lots of people that they shy away from folks that have bipolar disorder and schizophrenia, because even within the field, it's misunderstood, and there's not a lot of education. When I came out of my master's degree, I had yet to interact with somebody that had schizophrenia. And so, which is really, when you think about it, fascinating and not good from my perspective. And so it really comes from experience over time and understanding that, first and foremost, and what I really appreciate about your exhibit is that it's about the people first. It's just about people and who they are, and that the mental illness, it does not define people, and it cannot define people. It is just a part of them. And there are so many other aspects to each of us in each of the people in your exhibit. So I do appreciate that perspective on that, because I do think that it helps people understand that mental illness is not a death sentence. It doesn't mean that you're talking about scary, violent people. That we're talking about all of us in that. So thank you for that. It's a message that, as a, I've dedicated my life to working with people with severe mental illness on the treatment end of things. And I often don't get the opportunity to talk about recovery in that way, even though I believe that it is one of the most important things that we can do for people. If my staff were on this call, they would also agree. One of the things that I say, one of the most protective factors for anyone that has a mental illness is having a support system in place. Without that, it is almost impossible to do this alone, to go through recovery alone. And that's true of any illness, regardless of whether it's a physical illness or a mental illness. If I have cancer, if I have a physical illness, or I have severe depression, I need a support system in order to move beyond that and learn how to manage it. And so it's no different for mental illness. But yet, what I see every day is the suffering, because people are alone and they're afraid and they're ashamed to talk about it, because you don't go to a cocktail party and say, hey, I've been suffering from bipolar disorder for the past 6 months. I think most people are like, okay, great. I hope that goes well for you. And they turn around and walk away. It's not part of our lexicon yet. And so from my perspective, I think that a lot of the things that are happening on a national level, but, like what the Dover Mental Health Alliance is doing around education, I think education is the key to communities supporting people with mental illness. Because the more that we are educated, the more we understand that it is an illness, you can recover from it, and what people can do to help. And I think that, there are certainly things, general things that we can do, but I think that, Lynda, as you talked about, every person with an illness is unique. And so what they need is for people to ask them, what can I do to help you? Because what might work for me might not work for the next person. And what we need is unique, just like with any other illness. And so I think it really is about wanting to help. So it goes back to that compassion that you talked about, Suzanne, that we need to have more compassion for people, and the curiosity and the concern to say, how can I help you? I think that ultimately, I've got years of experience, but that's really what it comes down to. Because each person is unique. When they walk into my office, even though they say I have bipolar disorder, I have to ask them, but what does that look like for you? because everybody has a unique story, a unique set of symptoms, and a unique support system that's going to help them move through recovery. So I often hesitate to talk about what are the signs and symptoms, because I do worry that people get sort of boxed into, well, that's what this looks like, and that's the only thing I should look for. And really, it is, from my perspective, it's a change. It's a change in behaviors. It's a change in feelings, thoughts. That should be a trigger. If somebody is normally engaged in something and then they're no longer doing that, or if the way that they're talking to you or their tone or their pace is different, that should be a signal to people. It's really often the change from what people normally are like. And that's why they need a support system around them, because we all know each other well. I know my family members well. And so when I have family members who call me to say, I know something's happening. It may not reach the level at which you understand, but I know because of the look that they gave me or something that they said. And, you know, over the years, I've learned that, yes, the family members know best. And so I'm like, okay, tell me more. And let's explore that, because often they see the early warning signs of an impending episode for somebody, and it's so helpful. Suzanne, you wanted me to talk a little bit about adverse childhood experiences?
Yeah, that would be great, I think, because that we incorporated adverse childhood experience training into the Dover Mental Health Alliance model, because in some respects, not all respects, but in some respects, it kind of gets to the root level, potentially, of why someone, you know, is who they are. And, you know, it begs the question is, for many, many years, we ask, well, what's wrong with you? Well, maybe that's not the right question we ask, why people are behaving in a way that's not like normally typical or something. Maybe the question should be, well, what happened to you? And then maybe A, gets to the compassion level, but B, also kind of opens up the door to say, you know, if the person discloses what's happened, that maybe, you know, something more might have happened in their background. So the ACEs study is fascinating, and I would love for you, if you don't mind, to talk a little bit about that, talk about the kind of base level grassroots stuff.
Sure. You know, I will confess I don't have any of my statistics in front of me, so I apologize. I wasn't as prepared to talk specifically about the ACEs studies, but
that's my fault. I just threw it at you.
It's okay, but I can talk about it in general. And really, it is about it's about brain development and our development, and what we have discovered. And sort of as we knew all along, think about it not just as adverse childhood experiences, but childhood experiences. And what we know is that the developing brain requires all of these experiences, and that, you know, throughout childhood, our brains are developing. And so when there are adverse experiences, so when we are talking about things like trauma, abuse, and neglect, that's going to have an adverse effect on brain development. And so what we saw early on is that children who were abused and neglected tended to have a higher incidence of learning disabilities later on. And so what they began to connect is that their brains were not being stimulated as much as a child who was not experiencing abuse or neglect, and that their brains were not developing. And in the case of children who were actually neglected, that they actually saw in many of these children's brains atrophy in areas centered around learning. And so their brains were not fully developed. And so we see a lot of learning disabilities, and we also are beginning to make the connection with some mental illnesses as well, because of that sort of I don't want to call stunted growth, but it is almost an atrophy. And it's really interesting in that, and certainly I think all of us can now relate to this after the pandemic, is that neglect is actually one of the worst things that can happen to us as a human being, because we are social creatures, that the adverse effects of neglect are far worse on our actual physical body, our brain and our bodies, than any kind of abuse or trauma, which is really fascinating. I learned that early on in my career in psychology. And but it makes sense, because we need to interact. How many of us are just craving to hug each other, to have that physical interaction? I think Zoom and the video is great, but it's not the same, because our brains and our bodies actually crave interaction. They actually need it in order for good, healthy development to occur. And so this is where the whole idea of the adverse childhood experiences comes from, is understanding that those early adverse experiences can affect later on development. And sort of, as you said, Suzanne, it influences who the person is and how they interact with others. And it's really important to understand that and to try to mitigate that as much as possible as well. I mean, that's part of the research, is so how can we prevent, and we all know that abuse and neglect is bad, but when it's connected to developing brains, that gets, to me, that's a really scary place to be.
Yeah, it's a fascinating study, and I just find that training, which is really a presentation of about 2 hours to really kind of understand the background, this sometimes root cause of how people are, really gets down to the matter of, when in a school district or something, in a classroom, when a kid is behaving poorly, you make that's a bad egg, you know what I mean? They're just mean or whatever. But really, it made me think when I went through the presentation of ACEs, is to think, after I went through the presentation, is like, wow, really, what happened to this person? And that just immediately brings on that compassion that really helps you move past the whole stigma idea and what's wrong with what's happening, and can address someone maybe a little bit better than they've had from anybody else that hasn't reached that compassion level yet, So that ACE training we're offering that really anytime anybody's interested in doing that. We have classes kind of ongoing, but it's fascinating, and wish everybody took it. Wish everybody heard the presentation, because it's really great. Maybe sometime, we could do it right here on Zoom at the library or something like that. That would be great. So looks like we have, Lynda has just said a question. I can read it out too. Does also ACE recognize or look to lack of mental health treatment for the parent who may have not gotten mental health care? I'm going to have, Janet, do you have can you comment on that?
The ACE study doesn't necessarily talk about that or pinpoint the parents, but I do think that parental mental illness and mental health struggles is a big reason that children do have sort of adverse experiences. So it certainly does play a big role. And in my world, in working with children and families, one of the reasons that one of the departments that we have is called Youth and Family. And because you have to have the family involved, you have to have the parents involved. We don't just treat the children. We have to treat the family system. Mm-hmm. And it's so important. And often what we find when we have a child who comes in and the parents come in, everybody in the system needs assistance. They need treatment. And so we engage the parents along with the children so that we can treat the family system And it's really the only way to, in my mind, really the only solution. Because children don't grow up in isolation. They grow up in various systems. And so it's important that we're in all of those systems to help them create the most nurturing, compassionate, stimulating environment for those children as they grow up.
I have
Great
a
question, though.
for you, Janet. So when you're talking about, it's youth and family and you treat the whole system around that child, can you comment on, I bet you see that, this is generational. Maybe a child is there because the parents have gone through their own trauma, or they have their own mental, and then the grandparent, how often do you see that, or can you attribute things to that, or is it not really the case?
I do think for some of our families, there is a generational component to it. That maybe we have a grandparent who grew up in a home with substance misuse. And so the way that they relate to their children gets passed along to the parent, and then the parent to the child. So we see that in a lot of instances. So there are generational things that go on. But just as commonly, there are, severe mental illnesses that, just come about. So it's not a generational thing. There is a strong genetic component to most of the mental illnesses, but not always. So we see both. Definitely, we see both. Yeah. But what we know is that, parents are often just, particularly with children, parents are really struggling. They just don't know how to address it and address the issues, and they often don't know where to turn. And that's the other problem, is because there's not a lot of places. You don't just go to your neighbor and say, hey, so-and-so, I'm really struggling with him and I don't know what to do. People are like, geez, that doesn't sound so good either. As you said, sort of that, not that the bad egg, but I wonder what's going on in that house. Because, right? And there's a lot of judgment often around, well, if they just, I'll hear that sometimes, well, if they just did this or they just did that. There's a lot of people that have opinions about, it's really, they don't understand it as an illness. They see it as something maybe that the parents did or didn't do, that is maybe causing this. Yeah. And I think that's often a mistake, to be doing that. And we need to recognize mental illness. It just like we wouldn't be like, if the parent came over and said, oh, my child has leukemia, we wouldn't be like, I wonder what the parents did to cause that. We understand that now. 50 years ago, we may have said that, but we don't anymore because we understand that. And I really do expect that in 50 years, we will be ashamed, that many people will be ashamed in having to say that they said that, because I do think that mental health time is here. And maybe it was pushed a little bit by the pandemic, but I think it was here before the pandemic.
Oh yeah.
In some ways, I think science is catching up with mental illness, which is wonderful, but we are still in our infancy. We are really in our infancy in the understanding of our brain development and illnesses and how to treat those brain disorders. I'm excited for the next 50 years because I believe this is really our time. And I'm going to remain hopeful about that. I think these kinds of conversations are so important because it just breaks it down to everyday conversation. That it's okay to talk about things like bipolar disorder. It's not taboo any longer.
Yeah, that's why I too am excited seeing Lynda's exhibit and talking with her and learning about the 99 faces and the science that she, researched, and learning a lot from you, Janet, and community partners, and just really, again, being a real part of this community, which I love this community. My kids were all born here. I told you that they're all in school or have been in school here. And I just think this is a fantastic community, as are the communities around it too, for really drinking in and investing in this education awareness for mental health. I think it's essential if we want to kind of really turn the tide so that mental health is just viewed as regular health, as it should be. So I appreciate your perspective, especially on the clinical side of things, as well as your perspective on the next 50 years, because I'm hopeful too. So.
I hope so. Yeah.
So I think I just want to address one other thing. I know it was brought up earlier in the conversation that Steph George mentioned about, the focus on what caused them to recover instead of what caused them to develop a mental illness. I just want to, leave, I guess, my own thoughts on this last note, in that recently I took the instructor training for mental health first aid, which was fascinating in and of itself. But it was fascinating because we talked about hope. And we talked about that, when talking about physical illness, if someone, like, say, breaks their arm, like or breaks a leg. My son is a big skier. He breaks a leg. I'd say to him, I know this is a bummer. You have broken your leg. You're out for the season, but it's going to heal. You'll get some PT. And you'll get back on the slopes next year. You're going to miss this year, but you're going to get back on the slopes next year. But what Steph kind of let me think about in her comment is that people don't often know how to have that conversation of hope with someone if they disclose something that has a mental health challenge in nature. But those conversations can be had if you just learn how to use the language a little bit, and that you can say, I'm here for you. You are not alone. There are resources out there for you, and let me help you. As long as people, A, have developed that compassion, and B, understand what the resources are and feel empowered to be able to say that to someone, you can offer a message of hope to somebody. And that also, what Janet was saying is that recovery is possible and probable with the right type of support system, the right type of medication if need be, the right type of counseling. But that's, to me, again, going back, I'm a positive person. I just feel like that is a message of hope that is really, really huge on helping someone on their path to recovery. So it is possible if people understand and know how to have those conversations. But, if you have never had those conversations, you might have to practice. So, I'm going to just mention, if anybody's interested in learning more about mental health first aid and how to have these conversations, we're kind of on a quest to get as many people as we can trained in this, at least to have a good amount of people in the community. Then please reach out to me. We'd be happy to have you in those classes. But that's one of the things, is that hope piece for me is huge when we talk about mental health. And I'm a lay person. I'm not a counselor or anything like that, but I just think that's a powerful message for somebody. So that's all I have to say about any of this.
I think it's a great message. And I appreciate that, Suzanne, because I think that, coming from the clinical end of things, all of us that are in the treatment end of it understand that inherently. Because otherwise, I'm not sure that we would be in that. We inherently understand that part of our job is to instill hope in the individuals and their families. Because I'll tell you, sometimes it takes more work with families than it does with some individuals to instill hope. Because they've been dealing with their family member for far longer than I ever have. And so part of my job really is to tap into their own strengths and give them the supports that they need, so that they can have hope for their family member as well. Yeah. It's so important. And they're again, because nobody's having the conversation, as you said, I like the analogy with breaking your leg, is that, yeah, that's a bummer right now, but you will get better. But it's hard work too. You got to go to PT, you have to do this, but you'll be back on your feet again and skiing. It's the same with mental illness. It's no different. And the conversation shouldn't be any different of like, yeah, God, that's really a bummer right now. And that's really hard. But with some hard work and some support, you will get back to where you want to be and whatever that is.
Yeah.
Yeah.
That's great.
Yep.
And do you have any other comments you'd like to say? Maybe one more description of where, you know, you're at the YMCA in Concord, and maybe the how long it's going to be there and things like that.
Had to figure out how to unmute, sorry. Well, it'll be there through August at least. No, I think it's, I share Janet's thoughts about the time is now. And I actually think that the sidetrack of COVID actually shows us what scientists can do when they're really focused on fixing something specific. And so there's a mounting push right now for drug development in this arena, because although we're recognizing it more, there hasn't been a new drug development or a new drug delivery system in 30 years. You may think you've heard that there are new drugs, but they're really just the old drugs with little tweaks on them. So if scientists could come together, it's much more complicated than a vaccine, which is a virus, which is specific. The chronic mental illnesses involve hundreds of genes interacting, and they're different for each person. So it's very complicated. But what you can do is you can find out symptom control that works for a lot of people, even if there's not going to be a gene that we find for schizophrenia or bipolar. It's hundreds. And this is over, hundreds of thousands of DNA tests. They can't find the same genes that are active or inactive for folks. But drug development has kind of turned their back on this arena because they were looking for a gene. But now we know that what we can do is help treat symptoms, because people get on a med and then they drop the med because the side effects are so bad. So now that's where the big push goes. So if you could learn the science and learn that this is, sort of like, I like the analogy about leukemia. It's sort of like nobody caused it. It just happens because the interactions of your genes or whatever has caused this to happen. We just treat symptoms that people are suffering from and treat them with a drug that doesn't make them need to go off because the side effects are so bad. So, I mean, that's what the next big push, I think, is. We need beds and we need better meds.
Thank you. I think what I'd like to do, Amy, unless anybody else has any questions regarding this, you can certainly put them in the chat, but I'd like to share one more thing. And I don't know, Amy, if you can maybe help me, what I'd love to do is put this in the chat, but I'll also share my screen. It is about local resources. Let's see if I can find this. Here it is, because this is important. And since this is mental health, can you all see that? Maybe I have to make it smaller. Can you see that okay? May is Mental Health Awareness Month, and there are lots of different events going around the state. Here locally, right in the Dover area, we have some virtual events, as well as an Out of the Darkness Suicide Prevention Walking or activity event coming up May 15th. But you can check out the events on our Dover Mental Health Alliance Facebook page, as well as the Community Partners Facebook page. You can find the Alliance at Dover MHA. That's Mental Health Alliance at Dover MHA, and that connects also to Community Partners as well. But I've been on a couple of radio shows this last week, and I've been talking about the National Suicide Prevention Lifeline. We all have phones. Let's just put that number in our phone and have it, because you never know when we might need to use it for ourselves. Or what's important to know is that even if you know someone in emotional distress, you can call that number 24/7. It's a confidential line manned by crisis counselors, and they can help you if you are trying to, if there's someone that's in emotional distress, it's not just for the person that's in distress. So that should just be programmed in our mind. We don't have to memorize anything anymore. We can put it in our phone. But these are some local resources for help here in this area. So hopefully this helps. I don't know, Amy, I don't know how to share this, or maybe people can take their own pictures of it. If there's a way we can share it.
If you can send me a copy of that, I can send out an email to everyone after this
Sure.
with the PDF or a JPEG version of it, so everyone has access to it.
I do. Yep, I do. Yep, I can send that to you. So thank you. So I think we're all set, unless anybody else has anything else to say or question.
I think it's just important for to mention for the Dover Mental Health Alliance. One of the things that you always mention during meetings, Suze, is that it can be a business, it can be an organization, it can even be an individual who becomes a place. I think, yeah, I think the hard part for a lot of people is just to take that first step. And I guess my question for all of you is, what is the best way to take that first step in doing something like joining a Dover Mental Health Alliance and in trying to rid yourself or others of the stigma of mental illness or mental health? If someone maybe doesn't necessarily know someone or someone outright who has a mental illness, what is the best way that they can go out in society and participate and help to kind of fix, not fix it, but like get rid of this stigma, make it so these people that have a mental illness don't feel like they're being ostracized because they feel different in any way when they're really not.
Yeah. I think that was a question. When in my perspective, and Janet and Lynda, please chime in, because this is just how I feel. But people just need to become educated, and there's ways to do that. There's so many things online. I'd recommend looking at like NAMI New Hampshire's website. I'd look at that Mental Health America website. By all means, I put my email in the chat. Come to a Dover Mental Health Alliance meeting and learn how you can become involved. We're doing mental health first aid classes. Those simple steps really just start to open up people's minds and hearts. So, and it's easy. You just take that step. There's lots of people that are doing it. Come on board.
Yeah, one other thing, I would say, Amy, if there are people that feel that they don't know anybody with a mental illness, they're incorrect. 1 in 4 people suffers from some kind of mental health challenge at some point in their life. That means one of the 4 panelists here. And so we all know people that have mental health challenges or have a mental illness. And so I think it is really, as you said, Suzanne, getting educated and then just asking, being curious and being compassionate and asking, because we all know somebody that at some point in their life, we all have, as Lynda articulated at the very beginning, we all go through our own challenges and emotional, whether they are mental illness or mental health challenges or just a crappy time in our life, right? We all know somebody, and we are those people. And that really, just reach out and start asking, what can I do to help? What would help you? That's how people can get involved.
Perfect. I have a question from Joan, who asked, is it true that people with schizophrenia usually die in their 50s? I also think if we can expand on that too and talk about kind of the differences between schizophrenia and bipolar disorder, because I know the definitions of them have changed over time. So I think that would be important to discuss.
I could take that, or Janet, if you want to address it also. So the mortality rates with schizophrenia have a lot of different components to them. So one of them can be, and this is gets back to better meds. the gold standard for really great treatment for schizophrenia is called Clozaril. But oftentimes, Clozaril will affect different parts of the body. And it's not unusual to hear that the person on Clozaril, and we're asking people to stay on these meds, knowing they're toxic, will pass in their 50s. A lot of the meds cause or hasten diabetes. So almost all the meds cause a lot of really terrible side effects to sedation, over-sedated, huge weight gain, person on Invega or Risperidol may put on as many as 50 or 60 pounds the first year. So those affect an individual's health. And if it zaps your energy, we all know that we need to stay physically active to stay healthy. If the meds actually take your energy away and you're sleeping 10 hours a day because of the meds, your life is going to end more quickly. And I have to say that mental health affects a number of people in my family, and I would say on their meds, they are the most loving, wonderful people I have in my life. And it's heartbreaking to know what the meds do, but it's heartbreaking to go off the meds as well. So that's where the call to action is for Pharma to come back to the table in development. Can you imagine there's so many people that die of opiates and substance abuse because it makes them feel good and they can't stop using it? And on the other side of it, people with these severe mental illnesses that have drugs that help them manage their symptoms go off because they feel so horrible on them.
Mm-hmm. Right. Right. Yeah, I would just piggyback on that, Lynda, just to say for the person who asked the question, I think that the national statistic has been that someone with a severe mental illness typically dies about 25 years younger. So that I think the average age for a male is 78 right now. So subtract 25 from that. And it has to do with what Lynda is talking about. If you've been on a medication chronically for 20, 30, 40 years, that it certainly has toxic side effects over time. We are beginning to see a higher incidence of people. So one of the things that's happening in response to that is we are doing a better job with integrated care. So for example, here at Community Partners, we have a grant program that actually brings in a primary care practice into our site so that the services are integrated so that people with severe mental illness are getting better health care and primary care, that they're looking at their physical. Because their mental illness has been at the forefront, they often also, they don't take care of their physical issues. And so what we're finding is that folks are doing better. They're managing, even if they may have diabetes and developing that, they're managing it better, which is great. But what we're also seeing is into their late 50s, early 60s, we are beginning to see a higher incidence of people with cancer. And so, from me, I'm a holistic kind of person. When you've been on a severe medication, a pretty complex medication for 20, 30, 40 years, what does that do to your body? So I do think that there's so much more research that needs to happen. And as Lynda is saying, Big Pharma needs to come to the table again and really look at this. And we need to do better in terms of that. So it's still, we have a long way to go. When it comes to that and creating a quality of life for people that's without side effects and is without the danger of developing things like diabetes, like cancers as they age. I think there was a second part to the question about the difference in the symptoms between bipolar disorder and schizophrenia. Is that right?
Yes.
I think that The symptoms and the diagnosis have not changed. I think what has changed is sort of the fad or the news of the day. That often what ends up happening is we take the sound bites from something and we apply it to everything. And so I think that that's one of the things that's happened to bipolar disorder. And I actually somewhat blame some of those medication commercials that to a lay person they hear, oh, do you have abrupt changes in mood? Maybe you have bipolar disorder. Well, I don't know about you, but I have changes in my mood. That is normal human behavior. And so that is not what bipolar disorder is. The main difference between, I mean, they are both unique illnesses. Bipolar disorder is marked by a period of what we call mania, which is an elevated mood. It can be not needing as much sleep. There are major changes in the way people think about things. They talk about it as having a lot of energy, but often going along with that, there can be a period of higher energy, not needing as much sleep, but decision making can also be impaired at that point in time. People can get hyper-focused on things, and it begins to snowball for folks. That's what mania really is. This isn't just about, oh, I need less sleep. It is a very intense period in which people may be up for 70 to 120 hours straight without sleep and having a lot of energy. And it may also be about really impulsivity that's not normal for that person, in a way of making decisions that may not be in their long-term best interest. And then there is also a period in which people have severe depressive symptoms. So very low mood, they can feel suicidal, they can make suicide attempts, hopelessness, helplessness, amotivation. And those periods, each of those periods needs to last for a certain amount of time. This isn't, in one day that I feel really energized in the morning and I feel really depressed at night. And typically with somebody with bipolar disorder, the depressive episodes often are the major episodes. That mania typically doesn't happen frequently. But again, there's a whole range for people with bipolar disorder in terms of that. I know many people that I work with somebody that typically goes about 10 to 15 years in between manic episodes, which are then followed by a pretty severe depressive episode, and then things level out for this particular person. But that's just one example, whereas other people experience many different things. Schizophrenia is very different than that in terms of it is one of what we classify as a thought disorder, in that some of the hallmark features of schizophrenia are what we talk about, the presence of some type of hallucinations or delusions. There are also what we consider negative symptoms. So some of it can look like depression as well. So there's amotivation. So often we talk about it as sort of a flat affect, a flat mood that people can experience as well. And hallucinations there are many different kinds. The most common one is auditory hallucinations. across the board for people, followed by visual. There are also olfactory hallucinations as well. What else can I talk about in terms of schizophrenia? They're treated very differently. They are unique. They are separate and unique illnesses.
Joan has a question about schizophrenia. She's asking, do people with schizophrenia feel things instead of hearing voices? If so, are they in denial about this?
Do
you want to talk about agnosia?
Sure. I think that, one of the, I always talk about, I find schizophrenia one of the cruelest illnesses out there, in that people that have schizophrenia don't recognize that they have an illness, and that is part of the illness, and it's part of the symptomatology. It's almost, my analogy for most folks is with dementia, that when somebody is developing dementia, they don't know that they're developing dementia. And they have to rely on the people around them to say, no, that's not right. And so people with schizophrenia don't know that they have the illness. And that's the really scary part of this illness. And that's why I call it so, why for me it's such a cruel illness, in that the delusions themselves will often tell people that they shouldn't trust their family members, or of course you don't have an illness, it's everybody else. And so that is one of the it's one of the main reasons that people often avoid treatment, because and it is the most common thing I hear from someone who comes in who has a diagnosis of schizophrenia. They'll say, I don't know why I'm here. My family thinks I have this, but let me tell you, Janet, they're wrong. They're the crazy ones, not me. And the illness really doesn't allow them to see that. I don't know whether that helps answer the question that Joan had. And I don't know, Lynda, whether you would add anything more to that.
Well, there is this term called agnosia, and it's an unawareness. It's not someone in denial. There's
Right.
no way you're going to convince this person. It's not denial. It's in the front of your brain is the executive function that helps you to do things, and it makes connections, and it's in the frontal part of the brain, and there's some difference in the way it's functioning, so that people are unaware that their behavior is different or their thoughts are different. The person who I love, who has this illness, has told me sometimes, when he actually can talk about it, and that's not very often, probably like 3 times in the last dozen years, it's like dreaming during the day, and you can't tell if it's true or not. It's as if the dream is happening while you're awake, and you don't know which part is real and which isn't. Mm-hmm. The auditory hallucinations were expressed to me as, what if you were in a movie theater, if you can remember that, and somebody behind you is starting to talk or whisper? You know how annoying that is? Okay, can you imagine living like that? There's always someone behind you talking, and it becomes frustrating. And you want to find out what that is. And suddenly your brain tries to help you figure it out, because you're logically trying to figure out what this sound is that you hear that's behind you. Oh, it's a ghost. Oh, it's aliens. There's someone playing tricks on me. Somebody put a microchip in my head. I'm going to put And this sounds like a funny thing, but it really isn't. I'm going to put tinfoil in my head so these radio waves don't come in to my thoughts. That's how sad it is when someone has auditory hallucinations and can't shut it off. I mean, I sit in a movie theater and somebody talks behind me and I'm like completely distracted and upset. I can't imagine living like that.
Mhm.
So
And I think
there was this one other thing to answer the question. So there's schizophrenia, which is a spectrum. It's not, it's a collection of symptoms. And there's bipolar, which is also a collection of sort of mood disorders. But there is also an overlap, which is called schizoaffective disorder, which can be bipolar with psychotic features, or it can be schizophrenia with a mood disorder. So the more, and it's happening rapidly, the more research and discovery that's out there, we're finding that although we need to treat them like bipolar and schizophrenia, it's like this really big spectrum that goes deep and wide and high. So I think you're right. It's definitely evolving quickly.
Mm.
Okay, well, thank you so much. Does anyone else have any questions at this point? Because we're gonna start to wrap this up. But oh, Joan has another question. So, in support of schizophrenia, would you recommend that I go along with the stories? So if someone's
I on mute. No, I'm okay. I'll address it, and you should also, Janet, because I'll just go from my perspective. Is like, don't try to talk somebody out of it. You just can say, "Wow, that sounds scary," or "Oh, that must upset you," or you don't deny what they're expressing. You don't get into an argument about it. Don't, believe me, I spent years doing that. Gets me nowhere. And sort of the best MD psychiatrist, who was president emeritus of McLean Hospital, said, "Oh, I never argue with somebody when they're telling me something, even if it's a conspiracy theory." I was like, wow, I got to learn that one. No, don't try to correct it, because you're not going to. A good therapist, it may at the right time pose a challenge so that the person examines whether this could be true or not. But I mean, we're kind of dealing with this in society right now, where we have a bunch of conspiracy theorists that there's no way you can argue them out of it. It's that to a sort of like a really pumped up impact with an individual. Janet, your thoughts on arguing?
Yeah, I would say exactly the same thing, is that, it's as irrational as it may sound. I think the best thing that folks can do is listen to them. And again, you're not endorsing what they may be saying, but you're, actively listening by saying, wow, that must be scary for you, or whatever it is that they are articulating. And I think it is through lots of treatment in which we can gently help people begin to look at, and it's not about challenging their thoughts, but it is about giving them maybe some alternatives and understanding that. Yeah. Yep. Because as you said, there's no point in arguing at all, because for them this is real, and you can't convince anybody otherwise. Absolutely. And so you have to come at it from a different perspective, and I think that's really hard for people. And I think that's where it begins, where we get that stigma with mental illness, because somebody might walk away being like, oh my God, this guy believes this, and so it's, for many people, it's so hard to put yourself in their shoes, in understanding that. So I think that that's where this gets born out of. And again, it gets back to being educated about that.
Great. Thank you guys so much for being here tonight. So again, Susan, Lynda, Janet, this was wonderful. And thank you so much for opening up this conversation and talking to all of us tonight about this very important topic. Again, to everyone, I will send out a list of resources that Suzanne is providing me. So be sure to check your email. Otherwise, if you guys have any closing comments before we adjourn.
I just want to say thank you. And just to know, tonight we talked about different sides of the continuum here with mental health. We talked about anxiety and depression, all the way to, like, you know, the heavier diagnoses of schizophrenia or bipolar, but there's a spectrum all in between, and we're all someplace on it at any given time. So it's all part of our mental health. So thank you for the opportunity for having us speak.